Well, g'day. Look, it's great to be here on Fieldays here on live, and I'm Dr. Tom on a mission to try and get 10,000 farmers to measure, monitor and manage their health and risk. So look, today we're talking about the top paddock, our mental health. It's a big topic, 30 minutes, rural wellbeing and health, and it's an absolute pleasure and privilege to have Professor Rob Kidd in studio with me as consultant psychiatrist. Rob, welcome. And Dr. Cam Emerton, also a consultant psychiatrist, and active in the field of mental health. And Doug Avery, welcome. Can you hear me, Doug?
Yeah, I can hear you, Tom.
You're looking great, mate. How's Bon Varee down there in the sunny Marlborough?
It's not sunny today, Tom. It's overcast and quite cold, so we're feeling a bit glum. But what a great day to talk about mental health, so that's great.
Well, that's it. And that's like, mental health's a bit like that. The weather, some days it's raining in our head, and I guess what we're trying to do today is just get how we can turn those rainy days into sunshine, But it is a serious topic, and having been, 20 years ago, lost my marriage and gone through all that stuff, well documented, got depressed and got sad, and I figured it was my thinking that was making me, miserable. So I learned how to change my thinking, wrote a book, in 12 languages, Healthy Thinking, and I was a little bit worried the medical profession were going to come down hard on me and go, what's this emergency doctor doing about mental health? But Professor Rob Kidd at Auckland University, head of department, welcomed me in. Rob, in your words were, we run a broad church or something, isn't it?
That's the one, Tom. Yep. We had to seemed to me as though you're doing some good stuff, and it was good to be able to support it, really.
Yeah. So the last 5 years I've been out in the ambulance trying to keep people out of hospital. So Rob, it's between the three of us, I think we worked out we've got over 100 years of clinical medicine experience between us, evenly distributed, obviously.
Oh, yes, yeah.
Yeah, but you're a legend in psychiatry and mental health, and so it's a privilege giving up your time to be here. But you're a consultant psychiatrist. You're also you've been chairman of the Suicide Mortality Review Commission.
No, that's right. Yeah.
Yeah, and tell us what else you've been doing in the last 50 years of trying to keep people out of hospital.
Of the Mortality Review Committee, I was chair of that for about 6 years. I've also been head of the Anxiety New Zealand Trust, on the board there, which is an organisation which runs here in Auckland, but is actually getting a more extensive reach now, particularly because we've found that with the COVID-19 lockdown, that in actual fact we can do a lot of the psychological consultations. Our psychologists are finding that they can do consultations with people at a distance over the internet, and that's starting to work quite well.
So today I want to focus on anxiety and depression, and how do we measure it, how do we monitor it, and how do we manage it, you you obviously dealt at the thick end of it, people that really struggle and need professional help, right? But I think it's really important, let's get stuck into some, whether it's myths or some stuff out there that, rural suicide and mental health is worse than ever, and our health system's broken. I mean, from someone that works in the health system, I'd like to say it's not broken, and people are working bloody hard every day, and there is access, and there is, getting to it sometimes if you're in a rural location. And just tell us some of the stats about, we hear that, farming, agriculture is the biggest risk. What are actually the stats show us? What's the most dangerous sort of risks in mental health? Is it farming, construction? What is it?
Well, we did a study a few years ago now, looking across about 5 years, and we found that construction was the biggest, and then agriculture, farming and forestry were the second. They're both about, this is of suicides in actual fact, both at about 7% of the total numbers. So there is, and they were the highest amongst all the occupations, so they are there. But I think it's important to realise that we've seen a lot of information about the suicide rate and so on, and the fact that people talk about it going up and so on. In actual fact, the New Zealand suicide rate has stayed about stable for a number of years. There's been differences in terms of the population groups, particularly young people, where it has gone up, but across the population as a whole, it's stayed comparatively stable. And I think that there has been a lot of work done, in actual fact, trying to look at providing better access to people with the more depression and anxiety, the more common disorders. But I also think it's important for people to realise that in actual fact we all get depressed and we all get anxious, and it's not actually that doesn't make it a disorder. That's part of normal human experience. What happens is where these things become persistent or pervasive or start to interfere with your function and lead to you interference with other things such as your appetite and your sleep and so on. That's where it reaches the stage where you have to start thinking about, should I be starting to do something about this?
Yeah. Well, look, if you look at like 600 people take their own life in New Zealand every year, how many, is it 10 times that attempt or more?
Well, the numbers that actually go into hospital with self-harm, a lot of which is attempted suicide, is around 7,000 a year. The numbers of people that actually probably attempt but don't actually go into hospital is around about 20,000. The numbers of people that actually have some suicidal thoughts is probably over 100,000. So suicide itself is actually a comparatively low frequency event.
Yeah.
And so what that means is that we can't actually predict very well what happens with suicide. And I always think it's a little bit like if you draw a parallel with heart disease, for example, that a lot of people in actual fact have cardiac symptoms, have heart attacks. Only a few people die. And so trying to predict suicide and so on is actually quite difficult to do. It's really hard for us to do. One of the main things is like treating depression and treating your mental health problems as they come up, which actually stops people going down into that pathway.
They are important points. I want to come back to that. I just want to get dug in. Like, you're a resilience warrior, and with an A, and I'm sure sometimes a warrior as well, because you've written the book The Resilient Farmer, and like me out in the ambulance, you're taking the pulse of the rural community, and we can talk numbers and that, but on the ground, you're seeing people affected by drought, bovis, COVID, whatever it is, and you've put your name out there, and I commend you for it. But it must be hard for you, getting out of your depth sometimes, and just what do you do when people ring you up and say, Doug, my husband or my wife wouldn't get out of bed? What are you finding out there in rural New Zealand?
Tom, since COVID happened, my whole life's changed in that I used to have a wonderful balance of putting my energy into working at the top of the cliff, telling people about my experience, telling people about how I got through my time of difficulty, and sharing the stuff that I've learned. Since COVID-19, all my speaking engagements were basically brushed aside, so I actually started getting lots of people connecting me, just reaching out for help, and I've found that, to be honest, really, really hard. The balance is gone. So the energy for me and for this whole process, we have to actually give more people more tools so that when they actually get into a bad place, they have a bit of knowledge about how, firstly, to recognise that they are heading into a bad place, and secondly, how they can go about managing themselves to get out of that place. And if we just deal with people as they come over the cliff, we'll all get swamped.
Well, exactly, mate, and we all feel that, and with what you're doing and what we do in the hospital system, and Cam I'll come to next, and working in both hospital and private practice. And I guess that's the thing I found when I was going around with Farm Strong, and then now with Wrightson's going around the country in Hyundai, talking to people, and people are ringing me up and going, or saying my husband won't get out of bed. And I thought, well, have you measure everything else on the farm, so why don't we measure if you're, so that's why I came up with the Kind app, know your numbers, and you can go to the website and get a code, N8 PGGF, to download it, but you'll get red lights to say if you've got anxiety, depression or stress. So the first thing is to, a lot of people don't know how miserable they are, right? I'm sure you used to call yourself a miserable, I won't repeat it on air what you used to call yourself, but but you didn't know, right? Because it's just very insidious, that slide down. It's like your farm kind of slides down, you don't notice it. So if you get 3 red lights, anxiety, depression and stress, and a lot of people will phone Doug Avery, but I know you've rung me and said, who do you talk? So that's where we come to Cam, you're a consultant psychiatrist. We've known each other 30 years since med school days, and I remember being depressed myself and sitting watching the Lennox Lewis fight with David Tour with you, and I felt like I was in a porridge. I couldn't think. I'd lost my marriage and everything, and you're in this every day just dealing with people. So how do people access? Tell us what you do. For your day, what's your day-to-day job like? Doug's growing lucerne, and what do you do? How does your pathways? How do people out there access someone like you with your skills?
Sure. Yeah. I work with a great team of people who are very committed right across the whole mental health sector, and they do 24/7 work responding to people's concerns. Of course, we're always wanting people to reach out and make that concern known so that we can assist them. We work in the public sector, and I'm one of the acute team psychiatrists who respond to the needs of a community in the Waitemata District Health Board. And also I work in a private setting where we can actually assist people to address some of their broader concerns and find techniques and methods to be able to recover their independence and be able to communicate their needs perhaps a little bit more. That often is the challenge, isn't it? Being able to access the right support, but also having the motivation to step up and express your needs. The help is there. We hope we can always extend that further. We hope we can, to echo what Rob's saying, is to assist people to be able to understand when fatigue and stress and feeling overwhelmed with work pressures are becoming more of a disorder that can be treated with specialist help, because that help is there in a number of different ways.
Okay, so let's triage this and let's look practical out there, farming, practical people. The fence is fixed, broken, it needs to be fixed. My tractor, who do I ring, right? I just need to fix this. So the first step is to know that your tractor's not working, right? So you can get a bit of a handle on if someone's not sleeping, like loss of libido, they're putting on weight or losing weight, or, too much alcohol, those kind of things. You can get a bit of a feeling they're not right, or they're making mistakes at work, they're not concentrating, they're doing things they'd never do before. So you can get a bit of an idea. You can say, are you okay? And they might say, yeah, I'm okay. But you could go to the Kind app, download it. You get 3 red lights, depression, anxiety and stress, or just a red light for depression. My advice and what I say to people out there in the field is ask the question, have you had any thoughts of self-harm? Right? Like, have you thought of hurting yourself? And Rob, there's no evidence that I know of that asking that question, people are too worried to ask that question because they say yes, and they're worried it might make it worse. The biggest reason people don't do CPR, like I did last night somewhere else, is they're probably going to get it wrong, but you can't get it much worse than not asking that question. What are your thoughts on that as someone who's been dealing with this for 50 years?
Well, I mean, I think it's important to ask, and I think it's important for the person who's actually feeling that to feel comfortable telling someone. Because I think that's an important issue, and I think that certainly you don't make it any worse. And what you're going to do more than likely is actually make it better for people, because then you can organise for people to actually start to access proper treatment. And I guess that one of the things, just to expand on that a little bit, I think, and maybe in the rural communities, this whole idea of social isolation, that that there is the feeling that some of the work that's been done around suicide, for example, is that people, when they feel socially isolated. And so I think it's really important. Rural communities have got a good reputation, if you like, for providing support and coming together. Yeah. And it's important within that the stigma against asking for help or having some form of mental health problem actually gets diminished, so that people feel really comfortable asking for help and then accessing it.
So the important point is, though, but as you said, it's really hard to predict if someone's going to take their own life. But just keeping it simple, if I ask you now, like, any thoughts of self-harm, you're going to say yes or no or maybe, or skirt around if you're not that comfortable. If you say no and you kind of believe them, you get to think, okay, well, you can relax a bit, right? But if you go, this is just the way I do it, and I'm interested, like the cooking shows, we see them, the different ways to bake a cake, different ways to milk a cow, there's probably a few different ways to plant your lucerne, Doug, right? But then I'd say, like, okay, look, is that recent? And they might say, oh, it was 20 years ago or something. Okay, but if they say, well, yeah, actually this morning, and then I'll say, well, do you have a plan how you might do it? And they'll go, yeah, no, I've got a plan, it's really thing. And to me, that's a medical emergency, right? So I've got a duty of care, whether I'm out on my ambulance or it's a friend I saw recently, the same thing. I've got this duty of care. I want to transfer that duty of care to you or someone like Cam to go, you can't unsay that, can you? If someone said, I've thought of taking my own life, and people will threaten that even though they're not. Like, I know I do a lot of work in call centres, they're picking up, if I don't get my licence, I'm going to take my own life. There's the other side, right? But anyway, coming back to this, if someone says it, you can't unsay that. And that's the other thing I've found. People will go, but I don't want you to tell anyone. As a doctor, and then I can't undo that. So I either ring someone, their GP, their wife, their husband or whatever, and I want to transfer that knowledge to a health professional. And if you can't get through to anyone, and I know I work in EDs all around the country, you take them to the emergency department, right? Because that's what they're, or you ring the police. I know they're overstretched, but what are your thoughts on that? Or do you have another better way of doing it?
Well, I mean, I think that probably Cam might be the better person to answer this, having worked, with the crisis teams and so on. But there are crisis teams. I mean, most of the mental health centres do have a crisis team. There is the national helpline number that you can ring to make contact with, who will actually tell you who there is around who you can actually contact. And someone like Cam, as I say, I presume sometimes you even go out and see people.
Sure.
Does home visits and things. And in the rural sector, there will be services that are provided that people should be able to contact when things are actually happening.
Yeah. So my point is, Doug, that's what I'm trying to understand. Does that make it clear, like you and all those other well-meaning people out there that are out there taking the pulse, and whether it's a PGG Wrightson, a TFR that's out there, or someone selling a Hyundai, or someone else going to be, and they see this, or someone from Rabobank, they're doing it, Does that make sense? You want it once you get that knowledge, you got to transfer that duty of care. So you try and make contact with the helplines or someone like Cam, and does that kind of make sense?
Yeah, in the last few years, particularly since John Kirwan came out and sort of said it's okay to say I'm not okay, there's a massive difference in the attitude that people have towards mental health. It's no longer seen as something which is only happening to someone who's a bit nutty. It's actually recognised, and I think your work and Farm Strong and Mike King and myself and all the other people that are getting up there, the more familiar people become with the fact that mental health is not only their problem, it might be somebody else, or they're not a unique person, they're the only person that's ever felt this way. And when people start to come to that understanding, they will reach out, and they regularly do. It's a whole different game for me now than what it was 3 years ago. So much better.
Well,
we're on the right track.
Yeah, well, exactly. But there's still a stigma out there. But if we look at a farming metaphor, it's a bit like a drought, right? So I talk about the brain being the hardware and the mind is the software, right? So if you're not sleeping, you're drinking too much booze, you're self-medicating with alcohol, whatever it is, your hardware's not working, you're not sleeping, so you're getting run down, right? But then you've got to look after your hardware. That's the whole resilience stuff, exercising and all that. But you're at that point. It's like a drought, like just if you have all those paddocks that never had rain, you wouldn't not ever farm on them again, would you? Because they were in drought. So it's the same with the mind, so in the brain. So back to Cam, like if I use that metaphor, like when I was, the marriage breakup and all that, all of us go through this loss. And as Rob said, we all have anxiety and depression. It's how long it lasts. So if we go to the chemical side of things, so I've got this drought, I can't sleep, I'm worrying, I'm ruminating, am I going to lose the farm and losing my stock through Mycoplasma bovis or whatever, But then they come and see you. How do you assess people? And then you can restore that, put a bit of fertiliser on if you want to use it with medication and stuff. And you must rehab people and see people that were kind of broken, a bit of drought, you intervene, and they're back, performing. How do you go about that process? And that's a real thing for people to hope that there is. And people go, don't take medication. What's your view on that?
Well, you say a lot of those things clearly there, Tom. The hope, it's about the conversation, it's about connecting with people, it's being able to recognise the context that you're experiencing, the difficulties within in your workplace, on your own isolated space, perhaps if you live rurally, but being able to find the right resources. But we understand, and to echo Doug, there is a great conversation going on in rural communities. The Rural Support Trust is available there to many people, bringing people's ability to speak to, again, get assistance so that they can reach out and get expert input or specialist input. That's, we really want to encourage that further. And the youngsters are showing us how to do it better and better all the time. It's more of the conversation in their lives. But we really, again, want to ensure that the links in communities and the connection is encouraged, and the stigma about talking about people's anger, frustration, their losses, the stresses through all of the experiences that the rural sector and our entire society is going through currently, those are normalised to some degree, and to ensure that there is support if you reach out.
Okay, so that's great. But we've done the cup of tea. You've been referred to your rural farm advisor. You've got the accountant in. You've looked at everything. You've still got to send your stock away. You're still going backwards. It hasn't rained in like 3 months. You haven't slept. You're smoking like a train. You're drinking like a fish. It's like that's what it's like, right? And then you're not going to the pub, and we're not going out.
You're coping, aren't you? As best as you can.
You're self-medicating, and people go. It's not when we go to all these meetings. We go, well, we're preaching to the converted. It's the ones that are home that are too scared or don't want to admit that they've got a problem. But at what point, this is what I want to get, where do you reach out for that help? And it's like, what are some signs that people are psychotic or really need specialist care? Like, we're all hearing voices at the moment, right? But that's because we've got earpieces in, right? And so we can rationalise that. But when what are some signs that people really want to... It's like, if you're on the farm, you can go, I can do this, I can shuffle all this. But there comes a point where I actually need someone else to come in and go, I need some help, right? I need more hay from the Wairarapa if you're in the drought in Hawke's Bay or whatever. What are some signs people need to look out for that are real warning signs that they need to call the crisis team, they need to get specialists, they need the people like you to come in? What can people look
if you're
for?
witnessing stress in a loved one or a friend or a familiar, then you'll know that stress. You'll be able to see a change in their behaviour or the losses or their expressed anger or frustration. You'll hear it. It's what you do next, and therein you can get information from a general practitioner, from the Rural Support Trust, from Healthline. Just ring and ask, get a few pointers. There are a number of resources that have been established in the last few months about the COVID response, which really do invest into all of our community processes. And then also the hospital sector still remains available for escalation, as we do also in the private sector as well, to be able to meet people's concerns and respond to their questions, and to really show them they have choices, whether it's medication, whether it's therapy. It's certainly a well listening ear to be able to understand and work through goal setting, solving problems, and trying to structure a recovery process for them on their terms as well. There's no manual. It's just really work together on these things with a good connection.
And it's just like running a farm, right? There's all different things you can need to put in to make it. So, Rob, you must have seen, we've only got 5 minutes or so left.
Yeah,
we
sure.
could talk about this forever, and we should, but the thing is that, like, medication must have come a long way since you were a junior psychiatrist, half a century ago.
Yep.
And so, like, medication, people have all this I'm not going to take that, I'm not going to do that. That's like saying, I'm not going to put nitrogen on my paddock, right?
Yep. I mean, a
couple of minutes on medication.
On medication, I think treating the common mental health problems such as depression and anxiety, quite often when it becomes severe, often the first line choices are in actual fact psychological treatments. But once they become more severe and they don't respond to that often medication is the best thing. And I think that the thing about the medication is you have to take it regularly, and because a lot of people don't like being on the happy pills or whatever they like to call them, but they can make a big difference to people. And what they do is they may take anything from a week to 2 weeks to work, which is the other thing I think for people to be aware of. And when they and different medications, people respond to different medications differently. So I've had some people I've prescribed medications to, and they've come back and said, look, where's that been all my life? That's made a really big difference to me. And other people have taken it and said, oh, Doc, that isn't really doing much good for me. And then there's a range of other treatments that we can try. So for me, it's a question of actually trying to find, the right treatment for you. But it's really important in doing all that you actually take it and take it regularly. Again, we talked of John Kerwin, and if you hear about him talking about his medication, that he talks about the fact that he's took it regularly over a number of years. And that's the other thing, because not only does it, you also have to keep taking it until people tell you to stop, because if you stop medication too early, you can relapse.
Yeah.
Right. So it's a little bit like, for me, it's a little bit like treating high blood pressure. Right. If you want to treat high blood pressure to stop yourself getting a heart attack, to stop yourself getting major mental health problems and maybe getting some of those suicidal thoughts and so on, you want to make sure that your depression or anxiety is treated properly and effectively.
So fertilising the top paddock, Doug, we'll just get some closing words from you, mate. COVID's out there. I mean, do you get any pushback from people when you're trying? You've gone beyond my depth as the Lucerne lunatic, as you call yourself. You need to see someone like Cam. Do you get pushback? People, I don't want to see a shrink or something.
Where I go for, and what I try to encourage people to do is there's 4 things. If you notice somebody's lost their love, their connection, their purpose, or their hope, try to help them regather where that is. If you can't see that way of helping them, get them to go and get somebody professionally to help them. But a heck of a lot of people with a little bit of help, just from their loved ones, to say, well, actually, you've lost your job and it's lost your purpose. But before you get down, let's reframe your mind. And I think that we can learn those tools so hugely in this country.
So, well, that's all in the Kind app. Bit of a plug again. Download it. Have you lost your sense of purpose? And you're a fan of measuring the Kind app, Doug?
Like in all our farming, we measure everything and we measure our well-being. And I did fine on Kind until I put my height in.
Yeah. You need to grow another foot or lose a few kilos, mate. That's it, yeah.
It was only 2 inches, buddy, and when I put that in, I was all right. So I'm working on growing 2 inches taller.
Well, that's the top 2 inches, isn't it? The top paddock. Thanks, Doug, mate. We're coming in the ambulance your way. We'll call into Bonbury again and chew on some of that Lucerne. Cam, just some closing words for you, mate. I mean, and you know, how do people get a hold of you at the Recentre? Consultant psychiatrist.
We're a clinic that is available online. We can reach out in a timely fashion for a response from specialists, and recentre.co.nz. We hope to be across the whole of New Zealand within a couple of years. A new undertaking and exciting times ahead for us all.
Yeah. And Rob, Anxiety Trust, mate, what's you know the numbers off by heart?
No, don't know the numbers off by heart, but there is a helpline. Anxiety New Zealand Trust specialises in anxiety, and we have a large number of volunteers who are manning the phones who'll answer them for you and deal with things.
So if you go to the Fieldays, you know, live, you know, website, it gives you all the numbers to ring, and you can, you know, that's another important point. You got a lot of resources now that people are online. They can go to and do a bit of self-help because we're rural isolation being out there. You don't have to wait in a queue. That's a bit of an advantage, right? The internet's like you've got good Wi-Fi out there. Yeah. Yep. Anyone else want to say anything? How long we got before we're 1 minute? We got 1 minute. Okay, here we go. It's like speed dating.
Yeah, okay.
Doug, you got one last sentence, mate.
The last thing that I'd say is I'm a guy that went to hell and back, and the last 20 years of my life have been absolutely wonderful. And one of the things that I did is I learnt to manage my well-being. Yep.
Rob?
Yep, I mean, I think that's precisely right, that it's really important to try and treat mental health problems as something that can be managed. Yep. And that you can learn the skills, in actual fact, to help you learn to manage them yourself.
Yeah. Cam?
Sometimes this paradise that we live in isn't always a paradise personally, but there's help there if you're willing to connect, and people will listen. Just reach out.
Nice. Well, look, it's great to be here, and look, I'm looking forward to getting down the road in the ambulance, and we're going around the country. You can go to Dr. Tom on a Mission, like us on Facebook, and we're walking the talk. We're coming to a town near you, coming to a farm, and we're coming to measure, monitor, and manage your well-being. Don't forget to download that Kind app, N8PGG, and thanks to all our sponsors. And I love driving around in my Santa Fe, so thanks to Hyundai. Cheers.
Cheers. Thanks, Tom.